Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srimati Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. Friends, today we will have a discussion on a very interesting topic. That is, we know that Ayurveda is a great Indian medical heritage and it has been having the credit of protecting the life of the individuals or people since centuries together. So, no doubt, it's a great science, a science which is related to the nature, and a science which is formulated by keeping the nature as the reference point. But today I will going to talk about another interesting topic that we have different medications in Ayurveda, isn't it? Medicines. Usually, in terms of Sanskrit, we usually call it as yogas. We have different yogas, isn't it? Innumerable yogas are there if you count. The yogas which are mentioned in Charak Samhita, Shushu Samhita, Vagbhatha, Ashtangas, and other Ayurvedic books. So, do you ever analyze it that how they are formulated? Isn't it? Whenever we find a yoga, we find so many medicines there. Okay, so usually in the Asava Aristas, we have got number of medications, medicines are added, drugs are added. Okay, Chandra Prabhavati, if you see so many, almost all 50 medicines are there, drugs are there. Now, have you ever thought why this number of drugs are included there, medicines are added there, or these dravyas are added there, isn't it? So it is not added so randomly. If it is added, Chavanprashish contains so many medications, so many drugs. If so many drugs are added in Chavanprasha, every drug has got its own action. The beauty of the yogas which are mentioned in Ayurveda is it is not only introduction of one particular medicine inside the body, but that particular yoga as a collective. It takes care of the main drug which is present in that yoga and it helps for the digestion of that yoga or medicine. That means main medicine, metabolism of that particular main medicine, and also possible management of the side effects which may be possible by means of that particular main medicine. If you are confused, I'm making it very clear. Suppose a drug is there, a yoga is there, that yoga contains about 40 drugs. Out of them, there are one or two main drug will be there. That particular main drug will going to do the action. And rest of all the drugs which are present in that yoga, what we call it as prakshepaka dravyas, or what we will call it as deepanapachana drugs, like different drugs will be there along with that main drug. And the function of these other drugs is to facilitate the easy absorption and metabolism of the main drug, and also tackling the possible adverse effects or side effects of that particular main drug. So by keeping all these things in mind, that particular yoga is formulated. Now to give an example, simple example I will give that of the Dhatri Loha. We know that Dhatri Loha is one of the very famous medicine, popular medicine in Ayurveda, which is commonly used in day-to-day practice for the management of anemia or Pandu. The Rogadikara is Pandu, or especially this is quite useful for all such conditions of anemia due to iron deficiency anemia. It may not be much useful in case of anemia due to thalassemia and other hemolytic problems, because in thalassemia, spherocytosis and sickle cell anemia, excess iron will be there in the body, and we should not again give the iron. I think you are very clear, because see, anemia is there. In all the anemias, we cannot give Dhatri Loha. The reason is you will have anemia in iron deficiency anemia, what we call as nutritional anemia, and you will have anemia in congenital hemolytic problems like thalassemia, sickle cell anemia also. The cause of anemia is different in case of a sickle cell anemia. There will be abnormal destruction of the RBCs. Cause of anemia in case of iron deficiency anemia is a deficiency of the iron. So Dhatri Loha can be given in deficiency of the iron or iron deficiency anemia or nutritional anemia, and not in case of thalassemia or sickle cell anemia. In sickle cell anemia, already there is destruction of the RBC and there is already extra load of iron in the body. So again, you cannot give iron. If you are giving, you are doing the big blunder. It may lead to iron toxicity. So when they formulated a Dhatri Loha and mentioned that it should be given for anemia, the idea is very clear. What is the main drug in Dhatri Loha? The main drug in Dhatri Loha is Loha Bhasma. Loha Bhasma. Okay, it is nothing but iron oxide or whatever, Loha Bhasma. So Loha Bhasma is given inside the body. But if you see the other drugs which are mentioned in Dhatri Loha contains Loha Bhasma, and another important drug in Dhatri Loha is Dhatri. Dhatri refers to Amalaki. Other two combinations are, one is Triphala, another one is Trikatu, and another one is Trimada. Chitraka, Musta and Pippal. Vidanga, Musta and Chitraka. Trimadas are there. Triphala is there, Haritaki, Amalaki, Vibhitaki. And then we have got Trikatu. So these three combination is there. Along with that, Amalaki is there. Along with that, iron is there. That is, Loha Bhasma is there. Now, if you analyze this particular simple yoga, iron is there, and when it come inside, administered, it is present in the ferric form, and ferric form has to be converted into ferrous form. For the conversion of ferric form into ferrous form, so many oxidation process has to take place, and it requires vitamin C. And after it gets converted into ferric form, ferrous form, it has to be get absorbed or assimilated. Absorption of the ferrous form always requires an acidic pH. So conversion of the ferric form into ferrous form is facilitated by vitamin C, which is present in Amalaki. And later, for its absorption, there should be requirement of the acidic pH, probably which is done by Trikatu and Trimadas. It contains Chitraka, which increases the digestive power or digestive secretions like HCl maybe in the stomach. So which create an acidic pH and help for the absorption of the iron. Now once it is get absorbed, it is utilized well. Okay. And we know that if the iron is not properly metabolized, there are so many GIT disturbances. To tackle these DH disturbances may be in the form of the diarrhea or in the form of the constipation. Constipation is being more common. So tackle this constipation, we have got Trifalas. And if there is some digestive disturbances, then we have got Musta, which is Ramapachaka. So if you analyze this particular yoga, iron has to be absorbed very well, iron has to be converted into the suitable form, then it has to be digested, then it has to be metabolized, then it has to be utilized as an end product. So different drugs which are added in this combination take care of all these things at each step. So therefore I am telling that whenever we see any Ayurvedic yogas, although there are number of drugs which are present, every drug has got its own role in proper absorption and assimilation and utilization of the main content of that particular yoga. So in this Dhatri Loha, the main content is iron, that is Loha Bhasma. So other drugs will going to help that particular Loha Bhasma for its proper utilization. That is the beauty of Ayurvedic yogas. This is only one example. You can try this type of analysis for each and every yoga which is mentioned in our science. So that's the greatness of Ayurveda. Therefore, Ayurvedic medications are the effect of the Ayurvedic medicines are hold good even today also. This Dhatri Loha has been formulated so many thousands of years of ago. And there is no development of resistance, or this medicine is not outdated, because the medicine is formulated in such a way that it has take care of each and every aspect of its utilization. Therefore, the medicine which is formulated 5000 years back also, even today also it is working. There is no resistance or it is not outdated like the other medications of the contemporary sciences. So that's the greatness of Ayurveda. Thank you very much. We will meet again with another important subject. Don't forget to subscribe my channel and also please give your valuable support by giving your comment. Thank you very much.